more than 500,000 people living in Canada's biggest city do not have access to a family doctor. It's a crisis is playing out nationwide. Not enough family doctors. That's according to new information from the Ontario College of Family Physicians. Of course, family doctors are crucial, the first line of defense, so to speak, when someone has got a medical issue or concern. And if you don't have a family doctor, issues can go untreated, become serious, or hospital emergency departments can become the only go-to. Some of the challenges: certain family doctors expected to retire in the coming years, and there are also concerns that not enough new doctors are choosing to go into family medicine to replace those who are retiring. Listen to this.
Compensation model has not kept up with cost of living. I don't think family physicians are complaining that they don't make a good living. We're very happy and privileged to be doing what we're doing. But expenses like staffing, rent, supplies, all of those things are going up similar to other professions. And yet our compensation package that we get from the Ministry of Health has really not increased. It's making it more challenging to run an office, more challenging to meet patient needs.
All right, well, someone who knows those challenges firsthand is Dr. Lisa Salamon. She's joining me now. She's a family doctor working in Toronto. Dr. Salamon, thanks for taking the time. Your thoughts on this? Are you surprised? 500,000 people in Toronto alone, no family doctor.
Yeah, so sadly, I'm not surprised. Many of us sounded the warning bells. Probably in 2015, we started. The government at the time had closed off the options to one of the more attractive ways of practicing family health organizations that Dr. Grill, who we just heard, is part of, and I was part of as well. And so really what ended up happening is family or residents were being trained in these models, but then couldn't join these models to practice and start practices. So many of the graduates we had after that didn't form or didn't start comprehensive family practices. They went and did other things like, emergency or hospice or walk-in clinics, or just did locums and various other things. And so we've had many, many, many years of graduating classes where only a small percentage of them have either, started their own family practices or taken over those who are retiring or leaving. So none of this is surprising. We try to, advocate to the government. Since then, it really fell on deaf ears. And it wasn't until very recent when this government finally allowed new grads to enter these practice models. But unfortunately, it was too little too late by that point.
I know that across Ontario, you're talking about 2 million people, and I know it goes into the millions when you factor in all the provinces nationwide as well. In your mind, someone who's on the front line, you're a family doctor, I know you also work in an emergency department as well as a hospital. What's the solution?
Well, there's many solutions. I think one of the biggest things we're finding now is the burnout of family doctors, right? There's a ton of paperwork, a ton of things that family doctors are doing, which really isn't in the practice of medicine. It's a lot of paperwork, a lot of forms, running of businesses, a lot of things that other people could do to help out if they were funded. And so there's been a lot of advocacy and ask for government to fund these things, such as scribes. They have both AI and a person scribe, such as physician assistants, and even nursing. And there are models in the province where physicians work in teams with other healthcare providers, such as nurses, nurse practitioners, pharmacists, therapists, etc., which really allow physicians to work to the top of their scope. And I think that if the government funded more of these teams and more people to help with, especially the administrative burden, that will really alleviate a lot of the burnout that family doctors are experiencing, and also encourage and support new grads and young family doctors and enable them to start family practices.
And what about new doctors who are perhaps interested in other types of medicine that is, in some cases more lucrative, Dr. Salamon? Your thoughts on that, how much of an issue that is?
I see all sorts of forums, and I do talk to many learners that I teach, and it is a huge thing. There's a very large discrepancy amongst many specialties, right? So it's not just family medicine, which often is at the lower end of the spectrum. There's also other specialties that are at the lower end of the spectrum. And one thing that is unique, family doctors and some other practices, that they're office-based, and no one considers the amount that they pay in overhead. So we could say, like, maybe 10 years ago, most of us were paying, let's say, 25 to 30% of our gross compensation and overhead. And now, as we all know, we can all agree, inflation has just skyrocketed. And the cost of everything from staff to rent, to equipment, to running our electronic medical record has just skyrocketed in prices. So now a lot of people are spending, 40% of their compensation or even upwards more than that, and or can't afford the help that I'm suggesting that would alleviate all of that. And so unfortunately, the compensation for physicians haven't even kept up in pace. I mean, for many, many, many years. Initially, there were cuts to compensation for family doctors, and then there was really no raise, and then there was like a very minute where 1% per year. So it's been, and this has been going on for almost 10 years. And so it really has become a problem that family doctors can't run a business. I think people can understand that. And so new grads don't want to do it. It's too expensive. They're graduating on average with $300,000 loans. And if you can imagine, to start a new business would, even put them more in the hole and would be very difficult to do. So that's a huge part of the problem.
Dr. Salamon, appreciate you taking the time today and giving us your take on this.
Thanks for having me.
Dr. Lisa Salamon joining us from Toronto.